for Biotherapeutics, which is a company that focuses on treating cancer through NK cells or natural killer cells. Tracy also created a nonprofit called Saving Sophie to advocate for treatment for her daughter who was diagnosed with brain cancer in 2013. So please join me in welcoming Tracy.
Yeah.
Thank you so much for having me today, everyone. I am not a researcher or a doctor, but I am a oncologist. I always say, if we want to get something done for the parent of a sick kid, Saving Sophie, that is literally the mission my husband and I have dedicated the last 10 years of our lives to, is finding a cure for our daughter. Sophie was, next slide please, Sophie was diagnosed at 8.5 months old with a rare, low-grade optic pathway glioma brain tumor. Now these tumors have a 90% survival rate, but the problem is they have an 85% recurrence rate. So children like my daughter spend years, sometimes decades, getting chemotherapy and clinical trials that are second generation adult hand-me-down studies for these kids, just trying to find something that's going to work. And unfortunately, there's no cure for these low-grade tumors. Chemo can't get rid of them, radiation can't get rid of them, and we've never seen a child with an optic pathway glioma become no evidence of disease. Next slide, please. Sophie's story is a little bit different, though, in the fact that Sophie, at 9 months old, started using medical cannabis. We were introduced 2 weeks after Sophie's diagnosis to the former talk show host and film star, Ricky Lake. And Ricky had just begun filming a documentary for Netflix that was going to follow 5 families, all the children who had pediatric cancer. And she had done a lot of research to look at what had been done with cannabis in cancer. And what she found is that a lot of the studies had actually been taken off of the web, which was kind of bizarre. And these studies were showing real promise using this therapy. And what we saw with Sophie was absolutely incredible. Next slide, please. With Sophie, we saw so many different unique and individual things that she became deemed a medical miracle more times than we can even care to remember. For one, her immune system wasn't dipping the way other children on her protocol was dipping. So she was the kid that would go and have 4 weeks of chemotherapy. The 5th week, you would normally go in and make sure that the immune system is recovering. But Sophie stopped having to do that because her immune system wasn't dipping. We also saw seizure mitigation. You took Sophie off the cannabis, she was on Keppra, but you took her off the cannabis, she'd start having 10 seizures a day. You put her back on the cannabinoids, and she'd have 1 stop and stare seizure every 3 to 6 months. And this was such a small seizure that unless you were her mom or dad, you couldn't even really tell there was a seizure present. We also saw no trauma with her as far as emotional. She wasn't scared of going to the doctor. She loved going to the hospital and seeing all of her friends. She wasn't having these nightmares at night. She wasn't recoiled and shy like you see with a lot of these kids. To meet my child, she is probably the most outgoing person for the people that know her in the room. I'm pretty outgoing, but Sophie gives me a run for my money.
Oh, yes, I do.
Yes, you do, don't you, honey? And the other thing that was really cool, if you look at this picture right here, this was 48 hours after Sophie had an 8-hour brain surgery. And if you notice, there's no bruising or signs of visible swelling anywhere on her face. And this has been with almost every surgery she's had, except for one really, really, really bad one. And she still was healing 10 times faster than any other child that the doctors had ever seen. And they really couldn't understand it. Next slide, please. The problem with cannabinoids is that it wasn't getting rid of her tumor. We were seeing this incredible shrinkage that doctors weren't used to seeing, but the tumor would get smart and it would start growing again. So I knew I had to turn to research. We had originally had a company called Canna Kids that works in the field of medical cannabis for 7.5 years. We had our own t-shirt line. So I was working with thousands of patients all over the world with a focus on children, but we really worked with just as many adults. And what we were seeing in those patients were incredible. We had seen patients go home without chemotherapy, with no chance of survival, and with cannabinoids alone become cancer-free. And as long as they stayed on the cannabis, they remained cancer-free. So I needed to figure this out. I needed to understand why my daughter was so healthy compared to a lot of the other kids out there, but why she still had this disease. I originally started raising several $1 million for the Technion Institute in Israel, where they were doing groundbreaking cannabis research, where legally they were allowed to do so. Because in the United States, it's still considered a Schedule I, which means it has no medical benefit whatsoever, and it is the most harmful and addictive drug on the planet, which I can stand here and tell you today, after working with many children all over the world, it is absolutely not the case. It has extreme medical value, and it is not addictive like people have said in, you know, the Nixon era and the Nancy Reagan era, where just don't do drugs, it's gonna fry your brain. It's not the case with cannabis, we just haven't seen that. So when we worked in Israel, we made some really incredible advancements with both pediatric cancer and autism, but we weren't able to figure out what was going on with Sophie because we were never able to replicate her low-grade tumor in mice. So in 2018, when Sophie needed another brain tumor surgery, I knew this was my chance to get live brain tissue. And I needed to get it into mice. I was gonna originally take it to Israel for cannabinoid sensitivity testing, but when I met Dr. Jewett, she really started to strike these chords in me when she started to tell me about her work in natural killer cells. Now, a little bit about natural killer cells. They are the main driver of your immune system, the innate immune system that you're born with. You have an adaptive immune system that you build up over time when you're exposed to different viruses. So your innate immune system protects you from many, many, many different types of diseases, including cancer. Dr. Jewett has been in the field for 35 years. She was one of the original discoverers of what natural killer cells do and their role in cancer. And she became very fascinated when she started learning about Sophie and her successes as well as her other patients. So she agreed to put Sophie's tumor tissue for me into her humanized mouse model for free, nonetheless. But she wanted to study Sophie's blood. And when she got the results back, she called me up and she was like, I don't know how to tell you this, but your daughter is 6 years old. She should have an immature immune system. She has a brain tumor, so her natural killer cells should be malfunctioned. But yet your daughter has the highest functioning immune system of anyone I have ever seen in over 30 years in healthy adults. Let that sink in for a second. A plant that you can literally grow in a pot on your balcony or in your backyard was helping my daughter's immune system function in ways that one of the foremost leading minds in the field of natural killer cells had ever seen. So she said, the tumor's staying here, and you and I are gonna do some more research together. So we enrolled 27 patients, and we found the same thing in every single patient. The cannabinoids were reigniting natural killer cell function. So we started to see how our worlds were beginning to collide. Next slide, please. Now, my dad always told me when I was growing up, you can do anything you want to do and you can be anything you want to be. And I was crazy enough to believe him. Next slide, please. So I decided that I wanted to help Dr. Jewett in her mission to cure cancer, and I wanted our fields to really come together. What I also realized that there was more important things other than just university. We also, not only do we need a university to do this type of science and advance these studies, but we also need politicians to raise awareness about what's going on, especially in pediatrics. We need them to help us create easier pathways to market. Any researcher in here knows the amount of money that it takes and the years, often decades, it takes just to get a drug in the hands of doctors and patients. And we need industry, companies like mine and investors out there to fund this research because it takes hundreds of millions of dollars to bring a drug to market. Next slide, please. So a little bit more about Dr. Jewett before I really jump into the science. As I mentioned, Dr. Jewett has been in the field of natural killer cells for over 35 years. And she's really helped to define this field. She's helped to define maturation cycles. She's helped to look at how gamma interferon and TNF-alpha are working in these cells. She has also discovered that when these cells break, it is your first step in getting cancer. And in over 350 humanized mouse models, she has discovered that by restating this part of your immune system and by supercharging it, you can eradicate these diseases without toxicity. Think about that for a minute. The therapy that comes from healthy adults, you're going to hear me talk about primary NK cells. Primary NK cells are the cells that we're born with. You're going to hear me talk about supercharged NK cells. That's our proprietary process in supercharging these cells. But imagine taking cells from an adult. It doesn't have to be a perfect match. It does not like CAR-T. Supercharging those cells and putting them into a patient and that helping to restore immune function so that the immune system becomes the therapy. Not toxicity, not radiation. And we believe that all these things are still necessary because we do believe that there are going to be those patients that need a combinational therapy of natural killer cells and chemotherapy and checkpoint inhibitors and potentially radiation. But we do believe that there are going to be those patients that only need natural killer cells. Next slide, please. So what my company is trying to do right now, what Incore's goal is, we have 3 things that we're trying to accomplish. Number 1, translate Dr. Jewett's findings in her lab into humans. That is the supercharged natural killer cell therapeutic. We also have a patented diagnostic platform. It's 13 tests that look at the natural killer cell system and all of the other immune function on a cellular level that we have not seen other diagnostic platforms be able to do yet. It tells us exactly how those natural killer cells are working, how the T cells are working, how everything is working in combination with each other, and what the balance of those cells are. The third thing that we're working on, and this is kind of secondary right now, so our main focus is really the natural killer cells, and then the diagnostics, and then the cannabinoid. But we have developed a synthetic cannabinoid. Synthetic. It isn't illegal. It's not a Schedule 1. It does not create psychoactivity in the body. We've not seen any psychoactivity in any of the mouse studies that we've done. And we are tagging it with a protein that we believe is going to help boost the efficacy exponentially past anything that we saw in humanized mouse studies that we've already done. We've published now to a high-impact journal, cancer journal, not cannabis journal, which was very difficult to do, proving that cannabinoids turn the natural killer cells back on and have the ability to attack and kill cancer stem cells, the seeds to cancer, that chemo and radiation cannot see. It's these very cells that create relapse in patients, even when they show up no evidence of disease on the scan. So those are our 3 biggest initiatives. Next slide. Now, cancer is a disease of the immune system, and is, as I mentioned a minute ago, is when these natural killer cells fail, it is your first step in getting cancer. So by helping to reestablish the natural killer cells, we're helping to fix that core problem. We're not just slapping a Band-Aid on it and hoping it works for the next 20, 30, 40, 50 years of our lives. We're hoping that this therapy, we believe that this therapy has the capability of setting the body back to a state of homeostasis or perfect balance, where those natural defenses that we're born with are reinstated and are working effectively. Next slide, please. Now, what I love so much about natural killer cells are the safety profile. The safety profile is everything to me because I've watched my little girl go through things that no human being should ever have to go through. And having worked with so many patients all over the world, especially children, I've watched a lot of patients not succumb to the cancer, but succumb to the treatment. Next slide, please. What's so beautiful about natural killer cells is we're not seeing cytokine release syndrome. We're not seeing graft versus host disease. We are not seeing neurological symptoms or toxicity of any kind. When was the last time you heard about a cancer treatment that doesn't make you sick, doesn't make you lose your hair, doesn't make you miss a full year of school like my daughter, who ended up with C. diff. She couldn't walk for 6 weeks. She was having 10 seizures a day. It doesn't require brain surgeries to debulk a disease. It's really one of those things that we are super excited about. And when we did our 350 humanized mouse model studies, we didn't do them in 1 or 2 cancers. We did them in glioblastoma, pancreatic, breast, liver, lung, oral, colorectal, leukemia, ovarian, and low-grade tumors like my daughter's. Next slide, please. I want to walk you through a few of these cancer studies that we have done today. I want to start with glioblastoma because I know DAPG is very, very important in this room and brain cancers as a whole. And that is going to be our first pediatric cohort is DAPG. This is a tumor sphere, also known as a humanoid model. So what we do is we create this bubble and we replicate what's called the microenvironment of the human brain. And what that means is that we basically have a bubble and all of the immuno makeup of a brain inside of this bubble that we grow the cancer inside of. So it's in a human environment. And when we added the supercharged natural killer cells, which you see right here, you'll see the difference. These blue cells are penetrating deep into the cancer and killing the disease. Whereas if you have primary natural killer cells, it's not infiltrating the disease like what you want to see. Over here, when you compare the primary natural killer cells to the supercharged natural killer cells, look at the difference. You can see how much more killing is happening. Next slide, please. This is oral squamous cell. Now, the first slide right here is just a tumor alone. It just spreads and grows and goes everywhere. This is more representative of a patient's immune system, where their natural killer cells have been fractured, and there's still some killing that's happening with the disease, but the cancer still has the ability to grow. This is using IL-2, and I want you to remember this IL-2. This is something I'm going to talk more about in just a minute when I dive into Sophie's treatment a little bit further. IL-2 is used to boost immunotherapy today, and it is very toxic. It can make the patient very sick. Luckily, the half-life is short, so with the type of therapy that Sophie got, she only needed 5 days of IL-2, but the IL-2 had a substantial amount of side effects. Now, with the IL-2 infused natural killer cells, what we do see is we do see some killing, right? We see these clumping, that's where the cells are clumping up together and dying, but we still see this wall of cancer on the side, and we see this in all of the studies that we've done thus far. But with the supercharged natural killer cells, these little bitty specks, those are all the natural killer cells, and these clumps, that's the only cancer that was left that is now necrotic, dead, and was completely eradicated. Next slide. Now, we have put our therapy into one patient. Prior to my company owning the patents, there was a collaboration that happened in Beijing, China. And there was one patient that was able to be treated, then COVID hit, and the whole thing had to be shut down. But what's so exciting about this patient is he had non-Hodgkin's lymphoma, he had a telescoping wound in the roof of his mouth that was going up towards his brain. He got one infusion of 350 million supercharged natural killer cells that Incor now owns today. In 14 days, there was no evidence of disease in his blood, and there were 0 side effects. The man didn't even get a fever. 6 months later, there was a follow-up that was done. He was still cancer-free, living his best life, had tons of energy, and had never felt better. Next slide. Now I want to dive into Sophie and what we have seen with our little girl. Now, to give you a little bit of insight on what she's gone through. Diagnosed at 8.5 months old. She's about to turn 11 October 3rd. It's almost her birthday. Happy birthday, baby. Failed 7 chemos and clinical trials. She's had 10 surgeries, 5 on her brain. And yet this tumor still continued to grow. She has visual impairment, but her vision keeps coming back, which the doctors have never been able to explain, and it still continues to improve to this day, so we can see further now than she could when she was 6 years old and had much better vision than she did currently. She also has a whole left-hand side weakness from a cyst that grew in the motor cortex. Next slide, please. But a miracle happened. Our scientist, Dr. Jewett, was able to partner with a local infusion center and use IL-2 to activate my husband's natural killer cells. We were able to get, we didn't have to go through the FDA for this. We were able to get IRB approval because we weren't manipulating the cells themselves. We were activating them inside the body. So we gave Sophie an infusion of Josh's cells, my husband, say hi, honey. And we gave her one infusion at the end of September 2020 and then December 2020. Now, what you're gonna see here is, I've circled this area here where you see this big white chunky stuff. That is Sophie's disease. And what we continue to see for 16 months after the 2 infusions, no more treatment, the tumor kept shrinking on every single scan. For 16 months. Has anyone ever heard of a therapy that can keep a tumor dying for 16 months after only 2 infusions? Because I personally have not. She endured 12 days of sickness in all that time. That's it. And that was only from the IL-2, and it was only for a week and a half, and then she was fine. Her immune cells were incredible, and her disease kept dying. It is now stabilized, and Sophie's going to be patient number 2 in our clinical trials. And we are hopeful that with one low dose of our supercharged natural killer cells, that she will be the first patient in the world to have this tumor eradicated with therapy. Next slide, please. Now, you remember I was telling you about the IL-2. So Sophie got the IL-2 activated natural killer cells, and that is the pink line here. This is an e-site technology. It's a very advanced technology where it takes regular pictures every few minutes or days on end, and it gives us a real insight as to what these cells are doing. And we've studied our natural killer cells against every natural killer cell platform out there. There's quite a few. There's IL-2 activated, there is iPSC derived, there's placental cell derived, and we've studied them all. And across the board, we have found that there's really not a comparison. And as you'll see, you have the tumor growing, and it starts to die. But it kind of figures out, and the cancer doesn't completely go away. With the supercharged natural killer cells, it is immediately wiping out the cancer. And so that is what Sophie is going to be getting next. Next slide, please. This is what my child looks like on a natural killer cell therapeutic. Her immune function increased by 50-fold. Sophie had 0 functioning natural killer cells in her brain. There was no evidence of natural killer cells in her brain whatsoever, which was why we believed that disease was there in the first place. She had no defenses. But 12 months after her last infusion, we studied her brain fluid, and the natural killer cells were still there at high percentages and still functioning, helping us to reestablish that immune function. Her vision continues to improve. As I mentioned, she's only had 12 days of sickness, and her NK cells were harvested from my amazing husband, who is also donating his cells for our patients that we're going to be treated here in the near future. Next slide, please. So where we are today is we've already started to translate the manufacturing of these cells from Dr. Jewett's lab to a large-scale manufacturer. We have identified a group of brilliant doctors and scientists that have been doing NK cell therapy for 10 years now and doing human trials for major hospitals in the United States, out of the country. And we're going out of the country first because that's the fastest path to market. We're going to be able to use these patients. We're going to study with the same rigor as which the FDA requires here in the United States. We're going to use a third-party CRO to collect that data so that there's no contamination of the data whatsoever, and the FDA is going to see this as pure data. We're then going to take that and use it in our IND, our investigational new drug submission, to the FDA here in the United States with the hopes that you'll get fast tracks. Because in my mind, if you have a therapy that can't kill you, and we've never seen anyone die from natural killer cells in any of the research that's out there today, we've never seen it in our models, we didn't see it in our patient, natural killer cells are being given around the world, the safety profile is known, why are we having to work so hard to get this into the hands of patients? And that's where I need the politicians to help. I believe that there should be faster tracks for the therapies that are safer and more effective for these kids, versus these 2 years to get an IND, and then another however many years to get through phase 1, phase 2, phase 3, before it actually gets into these hands of these patients. Next slide, please. And that is where my next set of initiatives come from. I have been advocating here in DC for 8 years now, working to not only help pass cannabinoid legislation, work to bring more eyeballs and hearts to what's going on in pediatric cancer and the lack of funding that's going on there. And we really need to keep increasing that money. And we also need to increase those grants for industry. Because for companies like mine, it is very hard to get grant money. It usually goes to universities, and it just doesn't help companies like mine. We need expedited pathways to market. We need more grants for out of the United States trials, where these trials are being done with brilliant scientists and researchers that can help us get these therapies into the hands of patients faster. And I'm going to need philanthropic initiatives to help us with the out-of-pocket costs to pay for medical tourism, because that's what we're going to be doing is medical tourism. And I don't want any child to have to worry, or any parent to have to worry that they can't afford these therapies. So our charity Saving Sophie is going to be hopefully partnering with other charities and getting a lot of press and media around this so that we can raise that money to help these kids. And what's so amazing about natural killer cells is we're not talking about one drug for one cancer. We're not talking about investors having these issues with funding only one drug for a very small population of children. We're talking about using one therapy for, we hope, all cancers, because we're fixing the human immune system. So, next slide, please. I want you to imagine a world where you have a child who gets sick. You yourself, your own immune cells, could potentially be that child's cure. And one that's not going to take their life away. It's not going to leave them disabled, like my beautiful little girl. Sophie, I'd love for you to come up here with me so I can see you for a moment. I think it's really important to understand what these kids are put through, what is stolen from them, their childhood that's been taken. Thankfully, my little girl is just, she is a ray of sunshine everywhere she goes. Out there today who would like to partner with us, who would like to support us, whether it be advocacy, whether it be with fundraising, whether it be with political initiatives. I am here, and my family is here, to try and make the world for children suffering from cancer a better and easier place to live in. Thank you so much.
loudspeaker. Hallelujah. I need a break from all of this.